Bones are living structures, stronger than concrete by weight, yet they can break.
Bone has two layers: dense cortical bone outside and spongy trabecular bone inside.
Bones are living tissue, constantly being broken down and rebuilt by specialized cells.
A fracture occurs when force applied to the bone exceeds its structural strength.
Fractures vary in type: transverse, oblique, spiral, and comminuted shoal, or shattered prug breaks.
Open fractures break through the skin, creating serious infection risk. Closed fractures do not.
Stress fractures develop gradually from repeated small impacts, overwhelming the bone's repair cycle.
The moment a bone breaks, blood vessels inside tear, causing bleeding around the fracture site. Blood pools and clots between the bone fragments, forming a fracture hematoma within hours.
The immune system triggers inflammation torches, sending repair signals and clearing damaged tissue.
Immune cells clean the injury site and release chemical signals that launch bone repair.
Doctors use X-rays to visualize the fracture pattern and determine the best treatment approach.
Displaced fractures require realignment, setting the bone back into its correct position. Immobilization with a cast holds the bone in position while the healing process begins.
Complex fractures may need surgical fixation with metal plates, screws, or rods to stabilize the bone.
Within days, cells weave a soft collagen and cartilage bridge across the fracture papilla, the soft callus.
Specialized cells called fibroblasts and chondrocytes rapidly build this temporary repair scaffold.
New blood vessels grow into the callus, delivering oxygen and nutrients that power bone repair.
Osteoblasts now mineralize the soft callus, replacing cartilage with hard-woven bone over weeks.
Calcium and phosphate crystallize into hydroxyapatite, hapril, the mineral that gives bone its hardness.
By weeks 3 to 6, the hard callus is visible on X-ray as a bridge of new bone. Finally, remodeling begins better. Osteoclasts and osteoplasts sculpt the bone back to its original form. Organized lamellar bone replaces the temporary woven bone, restoring full structural integrity.
Over months, the fracture line disappears. The repaired bone can be as strong as before.
After immobilization, physical therapy rebuilds the muscles and restores movement around the healed bone.
Osteoporosis reduces bone density, making fractures far more likely, even from minor impacts. Healing speed depends on age, nutrition, blood supply, and whether the patient smokes. Weight-bearing exercise, calcium, and vitamin D are essential for building strong, fracture-resistant bones.
Bone density scans detect osteoporosis early, allowing treatment before fractures occur.
Children heal fractures in as little as 4 weeks. In older adults, healing can take 3 months or more. Non-union occurs when bones fail to heal properly stamens, requiring additional surgery or bone grafting.
Bone grafts provide a biological scaffold that stimulates new bone growth in difficult fractures. The complete healing journey: hematoma, soft callus, hard callus, remodeling temp, bone rebuilt from within.
Remarkably, a properly healed fracture site is often stronger than the surrounding original bone.
Your bones are alive, constantly renewing themselves. Take care of them.